Good evening and welcome to another edition of the Yuba City Medical Explorer. My name is Dr. Robert Peppercorn and my specialty is dermatology. I serve as host of this program. The purpose of the Medical Explorer is to explore the medical communities of Yuba and Sutter counties and to take you behind the scenes of medical care practices right here in our local area. Tonight we have a subject a little different than our usual program subjects. The Medical Explorer tonight will introduce you to a unique technique available in Yuba City that works wonders to reduce stress. The method does not involve drugs or x-rays and doesn't even require the assistance of your doctor. Tonight we will explore the field and technique of massage therapy. Our program should be very interesting and informative and enjoyable, and I hope that you'll stay with us for the next half hour. Before getting to our topic tonight, let's take a look at the latest medical news. 50 years ago, the flu virus was isolated. Today, there's a drug that can combat it, and the drug has been available in the United States for more than a decade, says a researcher studying the anti-flu drug approved by the FDA. A physician at the University of Michigan said recently that the drug amantadine has been shown effective both as a vaccine and as a therapy. As a vaccine, amantadine works almost immediately, and as a therapy, it cuts in half the time that a person is ill. This and other experimental antiviral drugs work against all kinds of type A influenza, the most severe variety, but are ineffective against type B influenza for unknown reasons. Lack of publicity about amantadine, licensed since 1966, has kept sufferers believing that prescription drugs cannot treat the flu. Vaccination is the preferred means of combating the flu, but only 1/5 of the United States population is immunized against the flu each year. My next medical news story concerns high blood pressure. New data suggests that even mild cases of high blood pressure may damage a victim's kidneys and can lead to dependence on dialysis and premature death. High blood pressure, which strikes 35 million Americans, has long been known to damage kidneys. But a new diagnostic technique reported in a recent New England Journal of Medicine found that damage occurs much earlier than was thought. The new study shows that lowering mild blood pressure through taking medication prevents development of kidney damage. The study tested 200 patients for an enzyme known as NAG in their urine, and a very early indication of kidney damage. They were tested before and 12 months after treatment of high blood pressure. The results showed that NAG decreased after 1 year, which means that kidney damage was decreased after 1 year of high blood pressure treatment. My final medical news story concerns the worrying student. Did you know that worrying and being upset before a school test can improve your performance on that test? New research shows that mild depression can improve the memory of students who are cramming for a test. A psychology professor created a mild, temporary depression in 15 students by having them read 60 depressing statements, such as, "I feel so bad I want to go to sleep and never wake up." The students later remembered more information than they did before cramming in other situations where they weren't depressed. What is usually an unpleasant learning situation for the typical student is more efficient for the depressed student, according to the study. You know, I wonder if this means that all those years of depression and suffering that I went through in school might have really helped out. I'll have to think that over. My health tip tonight concerns picking the right health club. We have all noticed a tremendous proliferation in the number and size of health clubs in the Yuba City area during the past few years. How does one go about choosing the right club? More and more people are becoming part of a regular fitness program. If you're thinking about joining one of these health clubs or fitness centers, be aware that the kinds of services each club provides and their health and safety policies vary significantly. In addition, licensing requirements have not been established for fitness center trainers, and many centers are staffed by people with no knowledge of biomechanics or exercise physiology. For these reasons, it's important to carefully evaluate a club before joining to ensure that you don't endanger your health while trying to improve it. Few people realize that anyone can own and operate a health club without adequate training in how to achieve physical fitness. Some centers are run by a medical advisor with a professional staff of fitness experts, while others are owned by a business person who has hired untrained personnel to supervise workouts. Before joining a health club or participating in a fitness program, be sure that the staff on duty have received training in physical education, exercise physiology, or a similar related field. Sign up only if a program is well supervised by trained and experienced personnel. It's important to make sure that the club you join has taken the health and safety precautions necessary to ensure safe workouts by its members. A complete health club or fitness center will have a pre-assessment physical examination or recommend health screening for all members. This screening is essential to determine the intensity, duration, and frequency of an individual's workout program. Without a screening, it's all too easy for an individual to be placed in a rigorous exercise program that could endanger his or her life. It's a good idea to have a thorough physical examination and consult with your doctor before beginning an exercise program, particularly if you're overweight or have experienced any cardiovascular or musculoskeletal problems. The club you choose should have an emergency policy and ready contact with an emergency medical service in our area in case of injury or illness. In future programs, the Medical Explorer will take you behind the scenes of some of our health clubs and fitness centers in the Yuba City area. So I urge you to keep us tuned in right here on Cable Channel 5. Now, on with the Medical Explorer. We have learned during many of our Medical Explorer programs that stress, anxiety, and tension can contribute and probably worsen many diseases. These stress-related diseases include high blood pressure, heart disease, stomach ulcers, backache, and even some skin problems. Tonight, I'd like to introduce you to a treatment technique that can dramatically reduce stress without the use of medications or drugs. This treatment modality is called massage therapy and has been practiced in our community for more than 30 years. Let's travel to South Yuba City and explore the interesting and helpful stress reduction tool called massage therapy with our area's leading expert. I'm standing in front of a very modest appearing house and office here in South Yuba City off of Barrett Road, right near Franklin Road. This is the office of Barbara and Bill Pebsworth. They've been practicing massage therapy here for more than 20 years, and a tremendous amount of relief of suffering and stress has come out of this office. Let's head in there now and actually meet Barbara Pebsworth and her husband Bill and see what goes on with massage therapy. Hi.
Hi, Doctor. I'm Barbara Pebsworth.
Nice to meet you.
Glad to meet you, too. We have a young lady here that I'd like to work on to show you what I do. Mary, would you please come over here? This is Mary Mayer, and she's been a patient for how many years now?
Oh, several.
How many times has Mary actually come over here, do you think?
Possibly half a dozen in the last 5 or 6 years.
What was the main complaint that you had when you came over?
I've had lower back problems and also recently some upper cervical problems in my shoulder.
What had you done before you decided to see a massage therapist?
I'd used heat and ice, sometimes medication.
And after coming here, what type of results did you have?
Very good ones.
After the first time?
Most usually, yes. Sometimes it took more. The last time it took probably a week still of rest.
Well, I appreciate you coming over today because you're going to let us actually perform, I'm not going to perform it, Barbara will perform a massage on you today.
Yes, I like it.
And we're going to go back in a minute and take a look. But you have a very interesting occupation that I've heard about. What do you do?
Well, I'm a clown since I retired from teaching. I have become...
Now, you're a clown? Now, what do you mean by that?
I'm Bunky the Clown.
Now, you go to kids' parties and things like that?
Yes, I do.
That's fantastic. So what's your service called?
Just Bunky the Clown.
And how could people get you if they wanted to?
Call me at 673-1650.
Well, we've learned something new today, not just about massage, which we'll see in a minute, but we have a clown in our service today, too. Before we, maybe two, maybe three, you never know. Before we go back to the area where you perform the massage, I've just been fascinated by the numbers of things you have here on your walls. Tell us a little about that.
Well, it started out with one that my mother gave me, and little by little we just gathered them up. One of the first one was, kindness is the only thing the blind can see and the deaf can hear.
Fantastic.
And from there, Abbey Press has a lot of them, and friends brought them, but I always screened them because I wanted them either a little bit sarcastic or religious. And so that's what we have. And you'd be surprised. People come in all uptight, sit down, and start reading the walls, and you can hear them begin to laugh, and I'll tell them, sit down, have a seat, relax, read my walls, don't climb them, and I'll be with you as soon as I can.
How long have you been actually performing massage therapy in Yuba City?
In Yuba City, a little over 24 years. I've been doing it for 29 years. But
and before Yuba City?
Marysville, before Marysville, Paradise, before Paradise Gridley.
And your family had been involved in this?
Oh, yeah. My mother did massage from 1944 on. And my aunt, who just died in November, had been doing massage since before World War II.
Well, I'm really looking forward to seeing what a massage actually involves. You know, we hear all types of unbelievably bad publicity about massage work in cities, but we're talking about really medical things here. And people really need to realize that. Massage therapy is really an art and a science.
Yes, it is. And, Doctor, I did give you a book on reflexology. Did you get to read it?
Yes, I did, and we'll talk more about that later on, too.
Okay. Because it really... This helps the body. The whole idea of being massaged is to help you relax. If I can get you relaxed, then the body can start to heal.
Well, I've certainly been impressed. Since I've been in this community for 2 years, I've had about 20 or 30 patients mention Barbara's work here, and I've also spoken to physicians, MD, doctors in the community who've recommended to their patients to come and see Barbara for massage work. The problem with relieving stress and aches and pains is a very important problem in our society, and a lot of the work that we do as medical doctors can't relieve this, and massage therapy often can. So, Barbara, why don't we head back and see what goes on in your office?
Okay. Let's come around this way. To cover you. The one thing is I never have my patients embarrassed. They are always covered. We never expose them in any way that they could feel like they were uncomfortable. The one thing, again, is like I've stressed, it's relaxation. And if you're uncomfortable or you feel uncomfortable about being exposed, there's no way you can relax.
So we defeat our purpose, then.
You bet. So we keep this as modest as possible and yet still be able to work the body.
Well, why don't you head back and see if she's ready, and we'll come in just when you say so.
Okay. Pardon me a second here.
I saw this microwave working back here. Does this mean we're going to have lunch before we start?
No, not really. It's how I get my towels.
Oh, why don't you show? You mean you put a towel? Now that has to be wet first, is that right?
Get it wet with cold water, then put it in the microwave for 2.5 minutes, and it comes out just right to put on her back. Is that going to be too warm, young lady?
Perfect. It's probably too warm for most people, but it's just right for me.
Her, yes.
I noticed that you really have her draped very well. There's hardly any skin exposed here.
That's the way it will be. Now we're going to start with the legs, and my husband will work on one side, I'll work on the other. And this helps to relax while that hot pack is relaxing the upper back. Then we will be...
What is that you put on your hands?
It's Ovaline. It's hypoallergenic. It's good for the skin. It has no perfume.
Albaline.
And it's been around since Sarah Bernhardt's day. They used to call it theatrical cream years ago.
Oh, I've seen on TV all these oils people put on and all this stuff. You don't use anything like that, do you?
No perfumes. I don't think it's good for the skin. All right.
Well, I like to hear that, I have to say.
Okay.
It's interesting also, as I look around your office, you have a paper on the wall that has about 10 MDs listed on there.
Well, the reason for that, so many people don't know where they can get help. And if I find something that's wrong on our patients, and I don't know what it is, then I'll tell them, please go see their doctor. And I have dermatologists, I have bone specialists, I have internists, podiatrists, and then I'll send them there, wherever they need to get help. A lot of people don't realize that, hey, this is my foot that is hurting. Go to someone who specializes in the foot. And if it's a skin problem, go to someone who specializes with the skin. Also, I had a doctor up in Grass Valley tell me, Barbara, you send me more patients than any MD in town. And I said, doctor, I see more skin than any MD in town. And if I see a mole that doesn't look right or something, I don't know what's wrong, but something's wrong. Let's send you where you can get the most help.
Right, that close relationship with medical doctors, I think, is one thing that makes your reputation so great in the community.
Yeah, well, it's the safest way to go, because after all, they came here for help. And maybe we can't help them, but we can find them the help they need.
Well, what is your husband doing right now on the
Well,
back?
he's just massaging and relaxing her, especially up in those shoulders, which he's better than I am with that one.
Now, are there exact locations that he works
Oh, yes,
on?
especially up through those arms. And Mary has a problem with her arms and shoulders, and that's one reason why he's going where he's going.
Feel any discomfort?
No, feels great.
Well, maybe I should do this next. What do you think?
You should. You might. I think you would really enjoy it. A lot of people do. I've had people who afterwards said, if I would have only known, I was afraid. They've seen the type of massage where somebody slaps and hits and chops and turns you in two, and it frightens them.